Hello, and welcome to our second video in a three-part series called Navigating Insurance, Denials, and Appeals. Our first video discussed how you can better understand your insurance plan, and this episode will focus on what happens if you've received a denial from your insurance. To help us understand the denial process, I'm joined by my colleague, Sarah Soto. Sarah, will you tell us a little bit about yourself and why you're interested in this topic?
Great. Yeah, thank you. I'm so happy to be here with you today. And professionally, I'm a genetic counselor, a healthcare professional with advanced training in medical genetics and counseling. I used to work with families navigating genetic diagnoses by gathering family and medical history to assess risks for genetic conditions, discuss testing options, and help families understand the implications of genetic conditions and test results. However, more recently, my focus has been on insurance. First, working directly for an insurance company, reviewing coverage requests specifically for genetic testing, and now at a laboratory trying to expand coverage for genetic tests, exome and genome sequencing, which can end the diagnostic odyssey and lead to personalized management and treatment.
That's great. So excited to get both the insurance employee aspect and your patient advocacy genetic testing aspect here today. And so to get started, let's just make sure that we're all on the same page. I want to make sure that we understand that you can appeal an insurance denial. What does that mean when somebody does that?
So, an insurance appeal is a request to an insurance company to review and reconsider a denial for a service. And a service could be a healthcare provider visit, a procedure like a surgery, or a test like exome or genome sequencing. And yes, you do have the right to appeal a service that is denied by your insurance.
That's good to know. And also good to know that while we're talking today about genetic testing, a lot of what we're discussing here can be applied to other services, as you just said. And last time we talked about the importance of a statement of benefits. But this time, as I understand it, the important starting point is an explanation of benefits. Can you tell us a little bit about what this is and how I get it?
Sure, yes. So, an explanation of benefits, also called an EOB for short, it's not a bill. It explains what was covered or denied, and if denied, why it was denied. It also includes information on how to appeal. If a service was denied, you'll receive an explanation of benefits, again called an EOB, in the mail, on the portal, or however you communicate with your insurance company.
So they will send that to you automatically as a
Yes.
trigger to let you know that the denial went through. Great. Thanks so much. And as I understand it, you can have a denial happen either before the service is performed or afterward. Can you tell us a little bit about what that difference is?
Sure. So if you reference the handout from the first session, you may remember there are two terms there that come into play. One is prior authorization, and the other is an insurance claim. Some insurance plans require approval for a procedure or a test before it is performed. This is called a prior authorization. It's also known as a PA. While a PA does not guarantee coverage or payment, it might be one of the requirements from your insurance to get coverage and payment. While an insurance claim is an invoice or a bill that was submitted to your insurance after the care or service was received. So if you receive a denial, it could be for a prior authorization, again, a PA, or for an insurance claim, depending on if the service has been performed yet.
That's good to know. And it makes me think that it might be helpful to know some of the reasons that the service might be denied. Is it important for me to know that before I start the appeal process?
Yes, it is very important to know why the service was denied because it will determine your next steps, including if you decide that you should appeal. So there are many reasons that a service could be denied. And so we have some of the most common ones listed on the handout that's accompanying this webinar. But for example, service could be denied because of missing information like a date of birth. So it could be something really simple. If that's the only reason the service was denied, you don't actually need to do an appeal. You can just ask your medical professional to make the correction and then ask them to resubmit it. However, if there are additional reasons a service was denied, then you need to address those too. So work through tackling one at a time if there are many, knowing that you can ask your insurance company as you go for help. And again, refer to the number on the back of the insurance card as to how you can reach your insurance company and reach out for help.
That's such a helpful reminder that even in this process where the insurance company is making the denial for you, that is still a potential resource that we can loop in. And frankly, if I'm hearing you correctly, that we have to loop in to better understand why we've been denied. So once I've done that work and understand, why my service was denied and when it was denied, what would then my next step be?
So after you've reviewed your explanation of benefits, again, abbreviated EOB, you'll hear that from your insurance company a lot. They'll say those abbreviations, but as Gay mentioned, just ask them what it means if you don't remember, but the explanation of benefits is really important. As you can tell, that's why I'm stressing it. So again, after you've received this EOB, if you decide you want to appeal, you need to carefully review the instructions from your insurance on how to submit an appeal, whether it be by fax, email, or mail. The directions will be on the back of the explanation of benefits.
And so once I've reviewed the instructions, see what's on the back of my EOB, know how to take the steps to submit, how do I prepare beyond knowing whether I can email, fax? How does that even work? What do I even start with?
Great. So first you should call your healthcare provider and ask them if they're appealing the decision because they could do it. If they're not going to, you can do the appeal yourself. So to prepare to submit, let your healthcare provider know that you're appealing and ask them for help. Your submission should contain several items, which again are listed on the handout that accompany this webinar, but I think it's helpful for us to touch a little bit on each one. And some of these items you will need to obtain if you don't have them already, and other items you'll be working on. So as I said, there's several items. First one is the cover letter. So you should summarize the reasons for the appeal and the documentation you're submitting. Remember, someone has to review all this information, so it can be helpful to orient them to what you're including. Make each one a separate bullet point so it's easy for the other person to then read. The next thing is the denial letter or the explanation of benefits, this EOB that we've been talking about from your insurance company. What they've already sent you, send it back to them, a copy of it for reference. Then next, clinic notes and or a letter of support from your healthcare provider. So again, remember, there's someone that's reviewing this information. You should be focusing on quality over quantity here. So make it concise. If you're sending 50, 100 pages of clinic notes, it's more likely that the reviewer may miss what's important. So if, for example, the service is for whole genome sequencing, the record should focus on the personal and family history supporting the specific testing, as well as how the test results could change care. So if you have a lot of records from your healthcare provider, review them yourself and provide what's most relevant to the service being denied. But if you're unsure, just ask for help. You can call your healthcare provider and ask them what's most relevant to the service that was denied. And then next, clinical guidelines or evidence. This is things like published studies that support the service. This also is often from your healthcare provider. So ask them for help again. Now, including this is especially important if the denial reason is for experimental or investigational. Then also include a statement that you're addressing each denial reason. Remember, it's important to address each one, but be succinct. Typically, it's just going to be a few sentences. And then finally, also include background information on your child's condition. You can get this if you don't have it from support groups like Child Neurology Foundation.
Thanks so much for that. That's a really great list and calling out of all the things that we need to prepare. Something I'm struck by, though, as I was in our previous conversation in episode 1, is that this is a lot of stuff to keep track of. Any tips for how we can keep organized during this process, or an estimate of how long the denial process or the appeal process, excuse me, takes?
Yeah, so Gay gave you a lot of great tips in this first webinar. One is, keeping copies of everything in a folder. So this is going to include what you submitted and how and when you submitted it. You should also contact your insurance company to confirm that they got your submission. And you write that down again, right? When you confirmed it with it, who you confirmed it with. They must respond to you within 30 days if this is for a prior authorization denial, and within 60 days if this is a claims denial.
Right. Another great reason to understand why you were denied and when before you start is that difference. Are there any additional steps I can take if my appeal is denied? Does that happen?
Yes. So sometimes your appeal may be denied, and there is another step that you can request an independent review. And this is when individuals not associated with your insurance would be making the decision. Your insurance must provide you instructions on how you can request this.
Great. That's wonderful to know. So there's been a lot of really wonderful, practical, and important information that you've shared with us today. But as we're nearing the end of our conversation, I'd love to give you the opportunity to say if there's one thing that we should take away from what you have to say in all of your experience, what would that be?
Yeah, so insurance just might be another area where you need to advocate. If a service is being denied for something that will better the health and well-being of your child, then you need to work with your insurance, not against them, to get the service your family needs covered and reimbursed. Your insurance is going to provide you with the instructions. You need to make sure you follow them. So while this might initially seem like a lot, we've given you some great tips to just kind of organize yourself, follow the steps one by one. You can do this.
That's great. Thanks so much, Sarah. This information has been so helpful and will hopefully help a lot of families out there who are struggling to work with their insurance company to get their children the services that they need to improve their health. So for all of you watching, be sure to check out the accompanying resources to this video, including the handout that Sarah mentioned a few times that goes a little bit more in depth with the reasons for appeal and provides even more information. If you're looking for assistance with specific insurance questions or other resource navigation concerns, please visit childneurologyfoundation.org/family-support or email us at programs@childneurologyfoundation.org. Thanks so much for joining us.
Thank you. Bye.